I thank the chair and ranking member, and I thank you all for coming today to testify. I'm really glad that you're all gathered together to discuss this critical issue, and I believe it will require a broad government approach to tackle the spread of illicit fentanyl across the public health, law enforcement, and international relations sector. In particular, I'm glad that in recent years, both the legislative and executive branches appear to have realized the devastating failure of the previous war on drugs and have turned to a system of helping rather than locking up drug users, which has led to mass incarceration of hundreds of thousands of Americans, mostly brown and black. Recently, Secretary of Health and Human Services Alex Azar indicated that he would be fully in support, for example, of needle exchange programs as part of his agency's plan to combat the HIV epidemic. But needle exchanges are also critical responses to the opioid epidemic. In Illinois, Lindsay Hartman of Kane County runs a van every Saturday that provides clean needles, clean straws, naloxone, and everything else a drug user needs to stay alive. And thankfully, the Illinois State Legislature passed a bill last month to ensure public health vans like Lindsay's can continue to run without fear of legal repercussions. One important item that's on that van is our test strips that can detect the presence of fentanyl in drugs. A recent study from RTI International found that, quote, people who use illicitly made street opioids and test them for fentanyl by using fentanyl's test strips are 5 times more likely to engage in safer drug use behavior than when the test comes back positive. So you can, end quote. So you can imagine I was disappointed to learn that Assistant Secretary of Mental Health and Substance Use, Dr. Eleanor McCants, has publicly come out against the use of these test strips. And she wrote, quote, is it our goal simply to stop people from dying so they can continue a life of safe, in quotes, heroin use, or should our goal be different, end quote. So Mr. Chester and Ms. Cave, and then anybody else who would like to respond, do you believe that fentanyl testing strips and other similar innovative measures are essential to preventing death, and shouldn't that be an objective in light of the current fentanyl epidemic?
Thank you, Congresswoman. I can't speak on behalf of anyone else. I can just
no, I'm asking you.
Yeah, understand. The approach is we laid out in the drug control strategy is 3 pillars, and 2 of those 3 pillars are public health. One of them is to prevent drug use before it starts, and then the second one is to provide treatment leading to long-term recovery. Those are our main efforts, and any public health interventions. And when I mentioned in my testimony innovative public health interventions, there are a wide range of things that we discuss and that we consider. We look for their efficacy in the public health space. All designed to save lives and to get people on their path to recovery. That is our principal concern, and that is the bulk of our efforts in the public health space, specifically when it comes to opioids.
So saving lives is a goal.
Absolutely, that is the single, and as it states in the strategy, the single criterion of success is to save American lives and stop Americans from losing their lives to these deadly drugs. Yes, ma'am.
Thank you, Ms. Cave.
So to echo that, I would say I'm not a scientist or a physician either, and so I would take this back to our department and have them answer as an HHS response in terms of what their opinion would be on this issue.
Okay, but it doesn't take a scientist, it seems to me, if test strips would actually show that fentanyl is present and prevent people, 5 times more people's lives saved because of it, that's really a values question.
Right, I would say safety obviously is number one.
Okay, thank you. I yield back.